Namaskar. I am Dr. Rajesh Kumar Sharma, Head Department of Critical Care Nursing and Coordinator for Scale and Simulation Center of Swami Rama Himalayan University. Today we are here to discuss about the basic life support. As you all know, the heart disease is the #1 cause of death in both men and women globally, and it claims more lives than all forms of the cancer combined. According to World Health Organization, approximately 21 million people died from cardiovascular disease in 2021, representing 31% of all global deaths. Of these deaths, an estimated 55% were due to coronary heart diseases and 45% were due to the stroke. So, cardiac arrest may be caused by the almost known heart conditions and is often fatal if appropriate steps are not taken immediately. Cardiac arrest does not discriminate actually, because it cannot affect all ages, genders, nationalities and races. This is why early recognition and immediate cardiopulmonary resuscitation or CPR are crucial for survival from the cardiac arrest. Healthcare providers are the backbone of the system of care in both the community and medical facilities. Advanced rescue measures cannot be successful on their own without solid basic life support and BLS. This training will guide you through the key practices of high quality basic life support. Every 90 seconds, a person dies of sudden cardiac arrest, and every third person, about adult population, is expected to have heart disease. But with the training you receive today, your action can give a victim the best chance of survivability. So, sudden cardiac arrest occurs without warning or within just a few minutes after symptoms appears. So, here bystander CPR, vital interventions before arrival of emergency services can increase the double or triple survivability from sudden cardiac arrest. So, this is most important here. If timely given CPR, that is golden time, will start from the initial heart attack. Within the 3 minutes, if we are giving CPR, in that case we can have the double or triple chances of survivability of a client. So, that is why we say early resuscitation and prompt defibrillation within 1 to 2 minutes can result in above 60% of survivability of a client. Why? What is the purposes of PLS? Why we go for the PLS? There the main purpose is that first is to sustain the life, because human lives are very important. So, sustaining it is our prime responsibility. By keeping alive heart and lung of a collapsed person by CPR, which is possible, and we have to go for the CPR and we have to see that how we can sustain the person's life. To prevent suffering, yes, by CPR we can restart the heart and lungs and supply oxygenated blood to the brain, lungs, kidney and other vital organs of the body part to prevent the sufferings of a client. Third purpose is to prevent secondary complication. Yes, by supplying blood to brain and other part of the body, we can prevent secondary complications like hypoxia, especially in the brain. To promote speedy recovery, that is the fourth purpose of the basic life support. Yes, if a client who is suffering with cardiac arrest, by giving CPR on time, client recovery may be faster than who receive it late. So, they are the purposes of basic life support. Now, let us see the chain of the survivability. The two types of chain of survivability are there. One is inside hospital care settings and another is the outside of hospital care settings. So, here chain of survivability, first let us talk about the two adult chain of the survival. One of the out of hospital, second is within the hospital arrest. So, the two chains have 6 links, but links differ slightly. Both chains include activation of emergency response system, high quality CPR and early defibrillation, post cardiac arrest care, which may be provided in the cath lab or the intensive care unit, and the recovery. For the out of the hospital chain, the difference is fourth link, which focuses on advanced resuscitation. In this link, a multi-rescuer team arrives and take over CPR and may perform additional advanced interventions. For the in-hospital chain, the difference is first link. It focuses on early recognition and prevention of cardiac arrest with patient monitoring and assessment, and if necessary, rapid response by the medical emergency team when a patient's condition starts to deteriorate. Now, let us see the indication when the CPR need to be given to a client. So, we have to, while assessing the person, we have to see that person is, if having cardiac arrest, then only we can start the CPR. So, for that we have to go for a appropriate assessment, which we will discuss in the later part of this module. Second indication is if the person is unconscious, if he does not respond to anything, and if the vital organs are getting interrupted, especially that there is no pulse and respiration, in that case we can initiate the CPR. Third condition is that choking. If the client is choking because there is some suffocation in for the patient due to some obstruction in the airway. So, in that case, if that airway is not getting cleared, in that case, if the or secondary client is becoming unconscious, we have to initiate CPR. Next is respiratory arrest. If any region, if the patient's respiration getting arrested and if person is not able to take the breath or completely fail, in that case we have to initiate the CPR. Electric shock. Yes, electric shock, if any patient or any client coming into the contact of the electric supplies. So, in that cases we have to start, because in that case heart is stopped working. So, we have to see that how we have to immediately start the CPR. So, the client get appropriate oxygen for his brain and the lungs. Next, the shock. Yes, there are different type of shocks, like there may be hypovolemic shock, there may be septic shock, there may be anaphylactic shock, there may be neurogenic shock, there may be cardiogenic shock. So, in these all the shock, the ultimate condition is that heart does not supply blood or it does not pump the blood to the body organs. So, in that case we have to start CPR. What is the main thing is that BLS techniques, why we should start the CPR, these chest compressions, because it will help in circulate a minimum amount of oxygenated blood throughout an individual's body to minimize damage to the organ and the brain in the event their heart stops beating. So, that is why we have to start this CPR. There are some critical concepts while we are delivering the CPR. High quality CPR improves a victim's chances of survivability. So, that is most important here. The critical characteristic of high quality performance of the CPR is that we have to start compressions within 10 seconds after recognizing the cardiac arrest. And second, the push hard and push fast. It means we have to compress with a quality and we have to do it very fast. So, that is why we say push hard and push fast. So, we have to see in that compression rate at the 100 to 120 chest compressions per minute with a depth of at least 5 cm for adult and at least 1/3 the depth of the chest, approximately 5 cm for children, and at least 1/3 of the depth of the chest or approximately 4 cm for infant. While giving the chest compressions, we have to see that we must allow complete chest recoil after each compressions. So, there may be the filling of blood into the heart, and then only if the person is, we are allowing the chest to recoil. If we are not allowing recoil, then the proper filling of the blood into the heart will not be take place, and in that case we will not able to pump the blood, enough amount of the blood to the body organs. Minimize interruptions in compressions. That is the most important. We should not waste time while giving the CPR. So, we have to see that how we can minimize the interruptions. In that case, we have to try to limit interruptions to less than 10 seconds, not more than that. Give effective breaths that make the chest rise. And in the last, avoid excessive ventilation. We should not give too much respiration, because sometimes we have seen many times while in practicing that CPR or while giving the actual in condition, people take too much breath inhale too much breath and then they expel everything. So, it may cause for the barotrauma for the client. So, that is why we should avoid it. Now, let us see the steps of CPR. The first step in the CPR is that we have to look for the safety. So, we have to see the approach of safety, how we can see that the client is safe. We have to see the safety of scenario, we have to see that safety of rescuer, we have to see the safety of the victim, and we have to see the safety of the bystanders. So, here in this scenario, we have to see scenario. Scene means like if you are outside, if you are a house which is caught with the fire, and you go over there to save the lives of the in the house. So, in that case you take the people outside, but you do not start the CPR giving over there where you find just out of the house. So, please take the client somewhere the things are safe, and in that there are the less chances of catching this fire. So, that place we can take the client and we can start the CPR. Similar way, if we are any collapsed house, we goes and we take the lives over from outside, and that's why we should not start within the house which is got collapsed. So, we have to take the client in a safe place. Similar way, on the roadside also, if we got an accident and then we find somebody who really requires CPR, so we have to take a client to the safe place where the flat is surface, so, and then where we can safely can give the CPR to the person. And we have to see the safety of rescuer, because if we are on the road giving the CPR, so we have to see that because a lot of traffic will be there on the road. So, that is why we should not start the CPR on the road itself, we have to take the client in the side. And we have to see the safety of victim also. We should not do the CPR on a like on the stones or maybe some big rocks. So, we have to see that there is some place where they are very flat, and where we can put the client in a flat position, in supine position, and we can start giving the CPR. And we have to also see the safety of the people who are helping to us. So, like a second rescuer or maybe the third rescuer, maybe some other clients, other paramedic staff. So, we have to see their safety also. So, in that scene, that is the reason we have to see the safety of every person who is involved in the CPR. After getting the safety, we have to look for the response of the client. We have to check for the response. So, we have to loudly shout, and we have to see that client is giving any response. We have to ask him, hello sir, are you okay? Are you okay? Are you okay? If he doesn't respond, in that case we have to see that really something is seriously going on. So, we have to tap the shoulders, and then if the person maybe sometime intoxicated, maybe sometime consumed too much alcohol or any this one drugs sometime. So, if it doesn't come out of this effect of these things after tapping too much time, then that case we have to see that assessment, and before assessment we have to shout for help, and nearby people whoever is there, we have to tell them to please go activate the emergency, call 108 and get AED for the patient. And after that we have to go for the assessment. In the assessment, first we have to check the pulse and after respiration. So, in the pulse we have to go in the left right of the neck or right side, both sides carotid pulsations are there. So, the technique of feeling of for the carotid pulse is usually easier to perform on the side closest to you. Use 2 or 3 fingers to locate the person's trachea, and then slide your finger into the groove just to one side of the trachea, and you will find carotid over there. Just feel it and see that whether it is there or not there. If it is there, then it means that patient heart is working. If not there, it means that heart is not working. And same time, while assessing that carotid, we have to also assess the respiration. So, always remember, abnormal breaths are common in the first minute of the cardiac arrest. So, these abnormal breaths are called agonal gaps and should not be confused with the normal breathing. Rescuers can sometimes mistake agonal breathing for normal breathing and fails to recognize the cardiac arrest and initiate CPR. And always remember, for assessment, pulse and respiration, it should not take more than less than 5 seconds and more than 10 seconds. So, within 5 to 10 seconds, we have to complete the assessment. Let us check out how to be done the assessment and the video. Hello, Namaskar. I Dr. Rajesh Kumar Sharma. Now we are here in Skill and Simulation Center of Swami Rama Himalayan University. Now we will see that how we have to do the assessment part of the client. If you find a client on a flat somewhere, the flat surface, So how to initiate the assessment part. So now we are here to go for assessment. So first of all we have to see the scene safety. Scene is secure, and after that we have to go for south the client, that we have to assess that whether patient is responsive or not responsive.
Hello, bhai, are you okay? No response.
So patient is not responding now. After that we have to go for south for the help, call for the help.
Activate the emergency response team and get an AED.
So before the team comes, so we have to first assess the client, we have to check out the carotid pulse, and while assessing the carotid pulse we also same time we can assess the respiration also.
No pulse, no respiration.
So if their pulse and respiration not there, and that after that we can initiate the CPR. So thank you so much for watching assessment part of this basic lab support, and we'll see the rest of part in the next module.